Yeah, thank you so much for joining us today. And we're so sorry for the glitches. That was just beyond our control. And we're back right now. We have a limited time. We just want to go straight to this discussion. If you have your question, please feel free to type them in the chat box. And I'm going to hand over right now to Dr. Jeremy. Once again, sorry for starting very late. Doctor, you can take over, please. Thank you.
Yeah, thank you very much, and I appreciate the opportunity to get to visit with you today. My name's Jeremy Powell. I'm a professor here at the University of Arkansas. I'm a veterinarian and have been here for about 20 years. I teach a class here in our animal science department on diseases of livestock, and also serve as our attending veterinarian here on campus. And so today, as you know, the topic of our discussion will be diseases of small ruminants. And I'll just get right to it. We're going to start with some real common ones that many of us are familiar with, and then work into some others as we go. But the first that I have here is really the clostridial diseases. Clostridial diseases are caused by a bacteria that's somewhat uncommon because it can form spores. And so as you can see in this picture near the bottom of your screen, we have the spore-forming bacteria with the spore on one end. Sort of looks like a tennis racket type of shape, but that spore allows this bacteria to last for a very long time in the soil and in the environment. So that you've had grazing livestock in a pasture that have had issue with Clostridia at some point, it's going to be there for an indefinite period. It'll be there for a very long time because of the spores. So a very hardy type of bacteria. And a couple of the common clostridial diseases that we deal with in sheep and goats would be the Clostridium perfringens, both types C and D. And then I'll talk about tetanus here in just a second. But with perfringens, you may be familiar with type C, which usually causes problems in younger animals, and then type D, causing problems in a little bit older animals, usually post-weaning with type D and pre-weaning with type C. But we call type C sometimes enterotoxemia or purple gut, and we can take a look at the pictures below to see why that is. But it causes a toxin to be formed by the bacteria that leads to hemorrhage into the intestine. So you can see in the two pictures that I have down here at the bottom of the screen, you get quite a bit of blood loss into the intestine. And when you do a necropsy or a postmortem exam on these animals that have had issue with perfringens type C, the gut tends to have that purple type of appearance. And that's why we refer to it with that name. Type D sometimes gets referred to as pulpy kidney, and that's just because of the type of lesion that we might see on postmortem exam with the kidney. But both of these usually have a predisposing factor of some sort of feed interruption, right? Or some sort of difference in feed intake that has occurred with the animal. So if it's pre-weaning, maybe we've sorted the ewes and the lambs off into two different pens, and then they maybe over intake on milk consumption once they're back with the ewe. Or if it's post-weaning, maybe we've given too much feed and they overconsume. But that's usually the predisposing factor that allows the overgrowth of this bacteria. And then, as I mentioned, they make a very potent toxin that can create the problems that we see. The issue with perfringens is, normally the lambs or the kids are looking fine today, and we go back to check them tomorrow and we have a dead one. So it happens very fast, and not a lot of onset with clinical signs that we might note and be able to treat. So most of the time, sudden death's the first sign of disease that we might see. If we do see some clinical symptoms before death, we'll note abdominal pain and perhaps some bloody diarrhea, but oftentimes it's sudden death. And so with that, our best way to control it is through prevention with vaccination. I'll talk more about that here in just a second. But first, I want to talk about the other type of clostridial issue that's common in sheep and goats, which is tetanus. And this one would be another one that you may be familiar with, but usually the predisposing factor here is some type of injury that has occurred, and that may be accidental injury or some sort of surgical management that we might be doing, whether it's banding a tail or banding the scrotum to castrate. But we get some devitalization of tissue, and you get a compromise in blood flow that would be normally there if the tissue was healthy. And that allows this Clostridium bacteria to grow in this devitalized tissue. And here again, we get toxin production. So this toxin's a bit different than what we saw with the other type of clostridial bug. And this one causes issue, as you may know, with normal neuromuscular function. So it causes tetanic spasms to occur, where we'll get paralysis with the animal, and they go into rigid muscle constriction, where they look like they have very stiff limbs and stiff back and stiff neck, those kinds of things. So oftentimes we'll see them standing, if we have issue, in a sawhorse stance, where their legs are very straightened and their back's very stiff and rigid. And another thing that we might notice is a decreased appetite, because they can't move the muscles of their face that they would use to chew food very well. So this disease sometimes gets called lockjaw, and you may have heard of it called that before. And then once the respiratory muscles are affected, we'll have problems with them being able to breathe, and death would occur from that. And as I mentioned before, the best way to control or prevent these diseases is just through vaccination. So we recommend with and at least with our flocks here that we have at the university, we try and vaccinate for these clostridial diseases towards the end of gestation, so that we get either the ewes or the does producing a lot of maternal antibody in that colostrum that's going to help protect the lamb or the kids for the first several weeks of life. And then we come back and vaccinate the lambs or the kids around weaning. So depending on when we wean, and sometimes that's variable with the given flock that we have here. Sometimes we'll start that prior to weaning and then booster it at weaning. Other times, with our other flock, we tend to wean those at around 70 days. We'll usually vaccinate at weaning and then come back about a month later and booster that vaccine. And then also, if we're keeping any of those ewe lambs back for replacement, we'll do that again pre-breeding. So we'll come back maybe in the fall of the year and hit them with another round of this booster vaccine, along with some reproductive vaccines that I'll talk about here in just a minute. We tend to use an 8 or 9-way vaccine with our flocks here. I know with goats, a lot of producers just like to use the CD&T, which is fine too, because those are the most common ones that we see. The 8 or the 9-way vaccines just protect against other clostridial issues that may not be quite as common in sheep and goats, but we might see them in other ruminants. And there are some that we can see in sheep and goats, so we tend to use that vaccine. Next up is respiratory disease, which sometimes we'll see in these young animals that will perhaps have some predisposing factors and some stress going on in their life, and then succumb to having issues with some of the bacteria that I have listed there. So the common causes of respiratory disease in small ruminants would be Mannheimia hemolytica, Pasteurella multocida, Mycoplasma, and Chlamydophila. Probably the most common two being the first two, and then these may be a little less common, but we can see any of those occurring, and often see it in younger animals. It could be pre-weaning, or oftentimes more commonly we see it post-weaning when we've commingled a bunch of animals into a weaning pen. But these bugs are fairly common in healthy animals. So usually they're in the environment, in your flock, and not uncommon to find them in healthy animals. And it's usually some sort of predisposing stress that can create the opportunity for the lamb or the kid to come down with this type of illness. Predisposing stress factors that may occur, any sort of respiratory irritant. So I have dust here, but that could be sometimes we're keeping these animals indoors depending on the weather. That could be things like ammonia that builds up when there's a lot of animals kept inside and you don't have good ventilation. So anything that acts as a respiratory irritant can be a predisposing factor. Their nutritional plane can obviously decrease their immunity or resilience against having something like respiratory disease. And then if we have, it seems like, especially if we commingle a lot of animals from different farms of origins or different flocks, and they're not around these other lambs and they've not been together, and we bring those together, then that is a key stress factor that will precipitate problems, usually with respiratory disease. We'll see that occurring. And then, anytime with small ruminants, sometimes we have a low amount of colostrum intake or poor quality, depending if you have twins or triplets, and the younger or the smaller ones may not be getting adequate amounts of that when they're born, and so they may be a little less prepared to deal with these type of disease issues. Some clinical signs that we might see with this disease, one acronym that a pharmaceutical company had out many years ago was DART, that helps us remember clinical symptoms for respiratory disease, and that stands for depression. The D is for depression, so that would be physical depression like we see with weakness or lethargy. The A was for appetite, so they have a poor appetite, don't seem to want to eat very well. R is the respiratory symptoms that we might see, so nasal discharge, increased respiratory rate, coughing, and the T is for temperature, so they'll be running a fever with this type of illness. And when we do a post-mortem exam on some of these guys, I have a picture here at the bottom, and then on the previous slide too, if you saw that one. But oftentimes it starts in sort of the cranial ventral portion of the lung, and then it moves up and back. But you'll start to see it right here at the bottom of the lung to begin with, and I'll show you that. This is maybe a little bit better picture, but you can see how the lower portion of the lung is affected there. And then it moves back this direction typically. So for treatment here, I always recommend to try and visit with your veterinarian about what they feel would work best. If you've lost some lambs or some kids to the issue, you can always take swabs to do a culture and an antibiotic sensitivity test to see what might be most effective to the bugs that's causing the issue in your flock. In terms of what's labeled and approved for sheep and goats, Naxel is approved for both goats and sheep. Micotil is approved for sheep. Other ones that I've used before would be Draxxin, and it seems to work well for respiratory disease. With any of these products, they're prescription, so they'll need to be purchased through your veterinarian. These being extra label, that can be prescribed through a veterinary client-patient relationship. That's what the VCPR stands for there in the center of the screen. But those meds tend to work well to help treat the respiratory illness. And also there are vaccines available. So if this has been a problem, or, if you're in a situation where you're buying a lot of feeder lambs or commingling a lot together, you may want to consider using the vaccine for those animals to try and help reduce the caseload that you would have of this type of illness. The next one I wanted to talk about was white mussel disease. White mussel disease is not uncommon here in the Ozark region. We have soils that are somewhat deficient in selenium, and white mussel disease is caused by a selenium deficiency. And with deficient soils, you tend to have deficient forage unless you're trying to do adequate mineral supplementation. So it can be one that creates problems. It too is going to be one that we see in young animals, right? It's in young growing animals that have a issue with muscle development. And when we look at the pictures here, white mussel disease is this pale type of muscle that we see here on the left compared to the normal red muscle. And then when it gets to important muscles, like we see in the picture below, which we're looking at heart there, when it starts to affect the heart muscle or diaphragm, it can result in death of the animal because of that. But early clinical signs of the disease, when it's affecting skeletal muscle, we're just going to see an animal that's weak and lethargic. They don't want to move. They act stiff. They act like they're um, oftentimes maybe like they have tetanus. They'll be in a sawhorse stance or have an arched back, but they just don't want to move because of the muscle issues that are occurring. Other clinical symptoms that we might see in a given flock or herd is we might see problems with retained placentas, or maybe a decreased reproductive performance where we don't get quite the breed up and the number of pregnancies that we were expecting. And then lastly, if we're doing a postmortem exam, we see this pale muscle in the animal that's affected. I took a couple of maps off of the internet here. This first one on the left is from the U.S. Geological Survey that shows selenium deficient soils in the United States. And the lighter the shade of the counties that you see there, the more deficient the soil is. And with the soil being deficient, obviously the forage would be deficient. So you can see here in central Missouri, we have several lighter shaded counties, and then right down here in the south central part of Missouri and north central Arkansas, sort of in that Ozark Plateau region right there. And then this one's a little bit older map that I had found, but it too shows that in the Ozark region, you have areas that may be inadequate in terms of selenium levels. So always a good idea to keep selenium, supplementation for your animals. What I look for on a mineral bag is selenium at 25 to 27 parts per million. That's what you want to see on the feed tag if you're buying loose mineral in a bag, and keep that out. The other thing that we do here is we inject BOSI, which is a injection of selenium and vitamin E, and that works well to help keep issues at bay so that we don't have problems with the young growing animals. We usually do that at the final month of pregnancy. When I was mentioning earlier about giving the CD and T vaccine towards the end of gestation for the ewes, we'll give them a BOSI injection. And this is the dosage that we use, 1 cc per 40 pounds. And then you can also give it to lambs and kids. We don't give it at birth, since we've given it to the ewes prior to them lambing or kidding. But you can if you haven't done that. So you can do that, and depending on how severe the issue might be in your given area, that may be something that could be recommended by your veterinarian. But we tend to wait towards weaning, and then we'll give another round to the lambs when we wean them at that point. Here's another one that we deal with in younger animals called sore mouth, and it may be one that you've seen before. The medical term for it's contagious ecthyma. It's caused by a pox virus, and it's definitely a contagious disease that can spread through a flock. We've seen problems with this here in one of the flocks that we have, but not in the other. And this issue is one that hangs out in the environment for a long period of time. Not quite as long as what I was talking about with the clostridial disease, but you can see this one for months after some of the scabs that occur with this disease have been shed, and it gets into the soil. So the pox virus is a pretty hardy virus that hangs out for a long period of time and can contaminate pastures and pens where there's been sick animals with this disease, and then be there for exposure for other animals that are placed there even months down the road. So what we typically see with this one would be blister-like lesions that will occur around their lips and around their nose. Then those blisters turn into ulcers, and then those ulcers will scab over, and they get these brown-looking scabs like we see in the two pictures here. And it's not really something that causes a lot of mortality or death loss, that sort of thing. Just a lot of performance loss, really, because these little guys will have sore lips and sore mouth. They don't want to eat, or if they're still nursing, which they can get it prior to being weaned as well, they may not want to nurse. And so, they're just not gaining, not performing, not keeping up with, like they should in terms of weight gain. The other thing that we can see secondary to it is sometimes ewes can have these types of lesions on their udder, and so that can be problematic because they'll then kick lambs off. They don't want them to nurse because it's sore, or they may get secondary mastitis to that. And there is a zoonotic potential for this disease. Zoonotic means that it can be transmitted to people. So anytime you're dealing with a lamb that has this issue, make sure you wear exam gloves and wash your hands after you've handled the animal. Not a lot that we can do to treat it really, but we can try and prevent it. And I'll talk to you here in just a second about this vaccine that I'm showing at the bottom of the screen. But treatment, what I've done is just try to do supportive care. That's about as best you can do because antibiotics are not very effective. They're not effective at all against a virus. If they have a secondary infection, then you might consider it. But it being a viral disease, really, you just try and support the animal as best you can. There is a live vaccine available. This vaccine is somewhat different than most. It's not one that we just pull up into a syringe and needle and inject. And this one comes with a special tool. If you see down at the bottom of the screen here, I don't know if you can see my pointer or not, but I'm kind of hovering over the tool that comes with it. And it has kind of sharp prongs on one end and then has a brush on the other. And you use the sharpened end to make a small lesion on the inside of the lamb's thigh area, right? Like we see in the picture here. So you use that to just gently poke the skin and open it up, and then you can use the brush to apply a little bit of the vaccine right there. And what happens is the lamb gets a very localized lesion, and it'll go through those same stages of being blister-like and ulcer and then scab over, like we were talking about what you might see on their mouth. But it only occurs right there on the inside of the thigh. And then, they won't get the generalized form of the disease. They won't have it on their lips and nose and go off feed and that sort of thing. I only recommend using this vaccine if you already have had problems. So it's not one to be using if you haven't had issue. And the reason why is it's a live vaccine. And once this area scabs over and the scab falls off, then you've got virus particles, in the soil and in the pen pasture area. So it's best to not using it unless you've already got problems, but it'll definitely help cut down on the severity of the cases and the performance loss that you have to deal with if you have an outbreak of this going on. Next up is another issue that we commonly see. You see it a lot in show lambs and show goats and things like that. But it's ringworm. Ringworm sometimes gets called club lamb fungus or wool rot. It's caused by a fungus called trichophyton. And this fungus can also be zoonotic, so it can affect people. So anytime here again that you're handling an animal with ringworm, you want to be wearing exam gloves and make sure you wash your hands afterwards. This one can cause these sort of scaly lesions that we would see on the neck and the head or around the ears sometimes. That's the most common area that you would see them. Sometimes they're kind of down the back here on top of the withers, but they're usually circular in shape. They're usually kind of grayish white and scaly, and oftentimes get transmitted from one animal to the next, either with them being directly exposed to an infected animal, or a great way to spread it is from equipment. And so if we've not done a good job at trying to disinfect clipper blades or halters or feed bunk or water bucket, those kinds of things, it can spread from one animal to the next. If left on its own, it'll usually heal up in 8 to 16 weeks. It takes a while for it to clear up sometimes, but it'll clear up usually just fine, but it just takes time. One thing that we might note is that on occasion where it was on a sheep that had white wool, that it may be showing a dark pigment when it clears up. That's not always the case, but sometimes you'll see a darkened pigment to the skin and then a darkened pigment to the wool or the hair that grows back there. The other thing to remember in terms of treatment is that we can use disinfectants to try to expedite that healing. And you can use things like iodine or chlorhexidine or a mild bleach solution. One thing that I've had luck with, both my daughters have shown sheep, and we've dealt with this before, but just to use iodine seems to work fine to help it dry up. I've put 7% iodine, which is fairly strong iodine. So you only use a little bit. You put 2 ounces of 7% iodine into an 8-ounce bottle of baby oil and mix that up. And then that oil tends to stick to the skin fairly well and hang in there. The only thing I would say about that is that iodine, will discolor the wool. So if you're going to the show next weekend or something like that, you probably wouldn't want to choose to use that particular disinfectant because it will discolor the wool for a little bit. They do make antifungals. One of the best antifungals is UV light. So I have a picture of the sunshine right there. And, many times this may be something that occurs most commonly on show critters, and they're oftentimes kept, in a barn stall, which is a shaded area and maybe they're not in direct sunlight. So just getting them out on pasture helps it dry up a little faster, where the sunlight can hit the skin. But they make different types of antifungals for livestock. You can also use an antifungal for people. This is one for like athlete's foot, but you just apply these things topically, and that seems to work well to help get it dried up a little faster. And then one of the things to remember, as I mentioned before, is just sanitize your equipment. So you can use a mild bleach solution, I use 1 part bleach, 10 parts water, just in a sprayer bottle like we see in the middle of the screen here. I'll mix that up and then spray things like the halters and the feed bunk and all with that to help control diseases like this. All right, I was going to move on to a few reproductive diseases. And I've got 3 or 4 I've got 3 infectious diseases and one that's a metabolic disease that we can talk about. The first one that I have here is enzootic abortion, which is caused by Chlamydophila abortus. This one affects both sheep and goats, so you could see it in either one, and oftentimes gets transmitted orally. So when you have one animal abort, you know how herding animals are. Everybody else in the pasture's over there kind of investigating and sniffing or licking or whatever, and any of the fetus or placenta or uterine discharge would have a high number of this bacteria, or the pasture may be contaminated where the ewe or the doe had laid down and aborted right there, in that general area. So that's one way exposure can occur. It can also be transmitted venereally by the male. So he would pick it up from an infected animal and then just mechanically transmit it on breeding other animals, and wouldn't be uncommon for that to happen. Well, what we see oftentimes with the placenta is kind of a brownish red type of coloration to the cotyledons. So that's one thing to look out, and it helps us differentiate a little bit from this one to toxoplasmosis that I'll talk about in a minute. But so this one will be kind of brownish red. Usually we see it causing problems in later gestation, and oftentimes it's going to affect younger animals in the flock. So it'll be, the replacement ewes that we've, or the younger ewes that may only be a couple, 3 years old, something like that. Tetracyclines are effective at treating this. If you have one abort, best thing to do first off is just isolate it. I would treat it with antibiotics. This one is, if it's left untreated, some animals can become chronically infected, and then although they may not re-abort at subsequent pregnancies, they can act as a reservoir for other animals in the flock. So these animals need to be treated with a tetracycline antibiotic. And then there's also a vaccine available. So pre-breeding, you may want to use Chlamydophila vaccine. You can see on this bottle, it used to be called Chlamydia psittaci. So if you've heard it called chlamydia before, the taxonomists have just changed the name on us like they do sometimes and make it confusing for folks like me to try and keep up with what the new names are. But it's called Chlamydophila abortus now. But same thing as chlamydia, if you know it by that name, same bug. Next here is Campylobacter fetus and also jejuni. Both of those can cause problems. And usually it's in late term gestation that we'll see it. If it doesn't cause abortion, you can see full term pregnancies that may just have stillborn fetuses, so they never take a breath when they're born, or you may have lambs that are born weak from this disease. Oftentimes with this disease, not only do you see aborted fetus, I have the pictures up in the upper right here. When you have a ewe that aborts with this one, you'll have fetuses that have started to decompose. And so what happens is oftentimes they die, and then they're in that womb for another couple of days before she aborts, and they'll look autolyzed or decomposed or necrotic once they're aborted by the female. So that's what we would look for to help us identify this. And then usually the female's pretty darn sick. So this would be much more common to see in sheep compared to goats. But the ewes going to have metritis, which is a uterine infection. She's probably going to be running a fever. She's probably going to be off feed. And that may not be the case with other types of abortion that we would see. We don't really see that with, toxoplasmosis, and that I'll talk about here in just a second. But certainly with this one, you see a sick female. Here again, tetracyclines are effective at treating this disease. Sometimes strains of this bug can be resistant to tetracycline. So I always recommend working with your veterinarian. They can do culture and sensitivity. There may be a better option in terms of an antibiotic. But here again, I would recommend antibiotic therapy because the female is going to be sick, and try to isolate her so that she's not contaminating your pasture with any further uterine discharge that may occur, post-abortion here. There is a kill vaccine that's available that you can give females prior to the breeding season, try and help boost their immunity against Campylobacter. This one's also sometimes called vibriosis. So you may have heard it called that. Now, we have vibriosis in cattle, and then this one gets called vibriosis in sheep sometimes. And the bug is a different subspecies, so it's just a little bit different than what we deal with in terms of what affects cows compared to small ruminants. The next one I have here for you is toxoplasmosis, and this is one that's not uncommon to see when you have barn cats that may be shedding some of the infectious stages of toxoplasm. So toxoplasm can affect many different types of mammals, not just small ruminants. It can also cause birth defects for people. So, if you've been pregnant and the doctor tells you don't change the cat litter box if you have a indoor-outdoor kitty, this is the reason why it's toxoplasmosis. Cats become infected. I have the life cycle right down here at the bottom right of the slide, but cats typically become infected from rodents that they might eat, or even birds can carry it, and the cat eats that dead animal, and then the cat will get the infection inside their intestinal tract. That's where it would stay in the cat as the definitive host, and then they're going to be shedding that oocyst or the infective stage in their feces. And so, cats will defecate on the hay pile or defecate perhaps in the feed bin if you have an open feed bin, and cover it up. You know how cats are, they're going to go, or even if it's just out in the pasture or wherever. And then that's where goats and sheep can become exposed is to that cat feces. And what we typically have here is a fetus that gets aborted that's not really decomposed. It looks like a normally formed fetus. And then we get this kind of gray white lesion on the cotyledon on the placenta. So that's one thing to look for if you see an aborted fetus or an abortion from one of your animals. We really don't have a treatment here. The antibiotics that I mentioned before for the other two are not effective against this bug. This is a protozoal bug, and antibiotics won't help here. So the best method to try and control risk for this disease is just minimize exposure to cats that may be carrying the bug. Yeah, the next one here is pregnancy toxemia. Usually this is one that this is also known as ketosis, so not uncommon to see this this time of year when we're getting ready to lamb out some ewes, especially with the cold weather that, we've seen here in the Ozarks region the last couple of weeks. We're having a beautiful last couple of days. The weather's been very nice, but last week that wasn't the case, and we were dealing with real cold temperatures, and that can be a real energy drain, especially if we have overly thin animals that may be getting ready to go into labor and give birth. So usually we see in this the last month or so of gestation, and what happens is just we have a decrease in the capacity of the intestine for the animal because the fetuses are growing, right? And usually in sheep and goats, there can often be twins or triplets. And so you got a really big uterus. There's only so much room in the abdomen, and then that just leaves less room for the rumen and the other parts of the intestinal tract. So just their intake is somewhat decreased because of the size of fetal growth during that time. And then we can have other stressors. And like one I mentioned is weather. And when it gets real cold, like we were experiencing last week and week before, that's a huge energy drain for the animal just to try to maintain normal body temperature. And plus they've got these big growing fetuses inside. So what happens is they use up their reserve, and oftentimes we'll see it on an animal that's overly thin, and we start to see clinical signs that develop. And early on, they may act like they're just weak and lethargic and have a poor appetite. And then that may also show with decreased blood sugar levels, they just act clumsy when they walk, and then they most often are going to go down on us. And that's the one sign that may be the first one you see is just a downed animal, and they're unable to get up. And if we can't get them treated and get them back up on their feet, they'll end up dying from that. Treatment here, usually I've used oral propylene glycol. So that is a sugar type of solution. This is a bottle. You usually can buy that over the counter at the feed store, Tractor Supply, those kinds of places. And I give 2 ounces 3 times a day. The other thing that I consider, if I want to try and save the female, I'm not too worried about the fetuses inside. You can induce parturition using some medication from your veterinarian. The best thing to do, though, is when we get towards the end of gestation, start to feed these guys adequate energy. So the E here stands for energy. We just want to make sure that they're getting maybe some extra grain intake, especially corn has high levels of energy, and do that for the last few weeks of gestation. Dr. Brown, I'll pause here. I just wanted to check to make sure that do I need to be wrapping up by 1 o'clock the scheduled time, or can we go over a little?
Yeah, I think I checked with the office manager. We can extend a bit, please. And also we have some questions for you when you're done talking. So you can please take about 15 minutes more, please. Thank you so much.
15 minutes more, okay. Yeah, so I just want to finish up with some other real common ones that we'll see. One that's familiar to all of us that have small ruminants is internal parasitism. And we could have spent the whole hour talking just about this. And I know that you're familiar that sheep and goats can have problems with Haemonchus contortus, which is the barber pole worm. And it's a voracious bloodsucker, that can take in a lot of blood from an infected animal. And these guys, the females lay a large number of eggs, and so they can contaminate a pasture very quickly with the egg production that happens from the barber pole worm. I have a picture of Haemonchus placei, which is a close cousin to contortus. And you can see they have a stylet as part of their mouthpiece, and they use that to puncture the side of the abomasum, where they then start to engorge themselves on blood. And so what that creates is just a decrease in the number of red blood cells, and we call that anemia, when an animal has too few red blood cells. And that begins to happen with these guys. And also hypoproteinemia. That's a decrease in the amount of protein in the blood. And when we lose protein, you get a decrease in oncotic pressure. And so you start to have settling out of fluid from the animal's blood vessels into tissue. And a common place for that is here under the jaw. And so we get bottle jaw and edema that has occurred just due to the hypoproteinemia from the blood loss that's occurring here. I oftentimes see, animals dropping in the middle of summer with this. So it seems like it's always worse July, August, when we have really hot temperatures. The pasture's really short. Perhaps it's been dry for a long time and we don't have a lot of grass left for grazing. And, just the heat stress and the anemia that occurs will be something that you see right there in those months of the year. The other big issue here is that we have major drug resistance, right? So there's some drugs that just don't seem to be effective at all anymore. I've not had much luck, with things like Safeguard or ivermectin. If we do have drugs that work, and I'm not saying that they always will, because I've seen some flocks that just have resistance. The homunculus is resistant to all drugs because of what they've used in the past or overused perhaps. But things that still seem to work somewhat would be, I see Cydectin occasionally being effective, and then also levamisole. It's sold as Prohibit. And so those two seem to be ones that are somewhat still effective at helping, the worst ones. I would only use it in the animals that really need to be dewormed, and certainly not deworming every animal in the group if they don't need it, and try and preserve the drugs that you have. And another thing you can do is FOMACHA testing. Many of you may have heard of that before. Probably all of you, if you've raised sheep and goats at any amount of time, have heard of this. But you're just looking for anemia by taking a look at their eyelid and determining on who might be carrying major infections of parasites versus those that aren't, and maybe selectively treating if needed, or maybe selectively culling, because one of the things you can do is just to try and cull animals that have heavy burdens of parasites, and only keep ones that seem to be resilient in the face of parasite burdens. We can also try to manage grazing. So with the infective stage larvae that are hatching out on your pasture and moving around away from the fecal pile that they were deposited in, they'll usually migrate, up the grass about 3 or 4 inches, but not much higher than that. So if you can do rotational grazing and move off of pasture before you have it grazed down too tight, that helps. Also, if you can do multi-species grazing, so if you can graze cattle with your small ruminants, or horses or other animals, they'll help vacuum up some of those potentially infective stage larvae that have been deposited by the small ruminants. And they don't do well in a horse. They can somewhat live in a cow, but really cows get more of this bug here that I have in the picture, this placei, homunculus placei, than they do contortus. So they don't really have huge issues with contortus like we see in sheep and goats. Also work with your veterinarian. They can help you do fecal egg counts. And some of you may be trained to do that yourself, and you can figure out which of the animals, have higher levels. And like I mentioned before, it's just best to try to keep and breed animals that are resilient in the face of parasites. Like they just don't have a real high infection, and get rid of the ones that are heavily burdened. Foot rot is another one that we deal with that gets caused by a couple different types of bacteria. Fusobacterium necrophorum is one that can cause problems, or also Dichelobacter. This one used to be known as Bacteroides, so you may have heard it called that before, but usually we see lameness in one leg with this. We'll have one foot affected. It's usually you got a swollen foot, or they're swelling around where the hoof meets the hairline right there. And they'll be limping and lame on that foot. Antibiotics are effective. Oftentimes I use oxytetracycline to treat this. You can use other types of antibiotics. Always visit with your veterinarian about what they feel like might be best for your given situation. But foot baths also work to try and help cut down on the amount of treatments that you may have to give. I saw this on the internet and included the picture here, but they have an area set up where they put their water trough with 2 wooden pallets on either side, and then they've included some spongy mats here in front of the water trough that they've charged with disinfectant. And we use these types of mats. We'll lay them in front of the door of our barn so that when we walk across there with our boots, the disinfectant will be on the bottom of our boots, so we're not going from one barn to the next and maybe cross-contaminating. Just good biosecurity. But they've laid it out here so that the animals can step on that when they go to water. But you can also use a foot bath. We've used foot baths inside the alley and made the animals run through. This just may be a little more convenient. I saw that and thought, well, that's a good idea. But you would charge this with some type of disinfectant. So you can use a bleach solution or copper sulfate solution, those kinds of things. Maybe not for sheep, but goats, it might work well. Copper's one that sheep can have toxicity issues with, but any sort of disinfectant, chlorhexidine solution, something like that, would be fine to use and just help keep their hooves disinfected and less likely to have infection with either of these bacteria. And by the way, both of these bacteria are common in the soil, and they're going to be out there in the environment. Usually we'll see more problems with them, either if you have like a muddy environment, or I also see problems, it seems like in the middle of summer when it gets really dry and their hooves start to crack a little bit, and you'll get secondary infections with this. Pink eye is another one that we'll see on occasion, usually in the summer months, and there's different causes with sheep and goats. Mycoplasma, Moraxella is another one, or chlamydia. Any of those can cause pink eye. Oftentimes we have some predisposing factors, like in the summer months, we'll have flies that carry it from one animal to the next, or dust or UV light acting as a irritant to the eye that makes it a little more susceptible and predisposed to having issues. Plant seeds can do the same thing. With this, what we'll see is usually an animal that's squinting a lot, the eye is swollen, they've got tears and lacrimation occurring. We'll get that sort of centralized ulcer type of lesion. And then as that goes on, we start to see these blood vessels that begin to grow out on top of the cornea there to that lesion. But we just want to try to treat as early as possible for this. I always recommend working with your veterinarian in terms of picking out an antibiotic. But what I've used a lot in the past are the long-acting oxytetracycline, so LA200 or Normycin 300. Either of those works fine. The dosage for LA200 is 4.5 cc's per 100 pounds of body weight, and for Normycin 300, it's 3.3 cc's per 100 pounds of body weight. But I'm oftentimes repeating that, in 2 or 3 days if need be. If those don't work, another one I've had luck with is Draxin. It's labeled for pink eye in cattle. It's not labeled for pink eye in sheep and goats, but your veterinarian can help you with that in terms of extra label usage with a veterinary client-patient relationship. But it seems to have worked well in cases where they haven't responded to the Oxytet. They also make some ophthalmic ointments, and those would be fine to use. If it's a show animal and it's halter broke and it's easy for you to handle it 2, 3, 4 times a day and put the ointment in, that'll help it heal faster as well. Next here I have caseous lymphadenitis, and this is one that we see causing problems with abscesses and lymph nodes. And we'll usually see the lymph nodes around the head and neck area affected. But it can cause abscesses even in internal lymph nodes that we cannot see. So this one may occur, in the sternal lymph node in the thoracic cavity, or in mesenteric lymph nodes in the abdominal cavity. And we don't see those, outwardly like we can see in the picture here with the lymph nodes that are affected on these animals. So, just know that if it's happening, sometimes we can see the outward effects with the lymph nodes, but it could be causing internal problems too. So these animals sometimes, can begin to have poor appetites and losing weight and things like that. And that could be due to lymph nodes being affected on the inside. Oftentimes what we'll see with these lymph nodes after they've abscessed and gotten very enlarged, they'll rupture and drain, right? And if you've had problems with this, you've seen the drainage. It's kind of a yellowish, really thick discharge, kind of a toothpaste consistency. Sometimes it has a greenish tint to it. Most of the time it's sort of yellow, though. That's what I see. But we call the disease CL, or caseous lymphadenitis. It's caused by this bacteria called Corynebacterium pseudotuberculosis. And this bacteria does a great job at sort of walling itself off from the rest of the immune system so that it can't be effectively overcome very well by an infected animal. And so really one of the best ways to control the issue is cull animals that have problems. But if you've had it on your place and it's been there for a long time, culling may not be the best option because it's just unreasonable in terms of being able to cull that many animals. The other thing about this bacteria is that it lives for a very long period of time in the soil. So if you've had cases on your farm before and the things have ruptured and drained onto the soil and in the environment, it's likely going to be there for a very extended amount of time. Other things that we can do to we maybe help the animals, we could surgically drain it and flush it with a disinfectant, flush the affected abscess. But then again, there's risk with that because any of the drainage that's going to come out, is going to release organism, and it'll be in the soil or on the feed bunk or in the water tank or wherever, so that other animals are becoming exposed. There is a vaccine available. This is one that's labeled for sheep. It's called Case-Back. Another type of vaccine that you can get for this disease is an autogenous vaccine that's made by Meta Labs out of Texas. I believe their laboratory is in San Angelo, Texas, but they make one for goats, and it can be used in goats. This one's not labeled for goats. I don't know if that some of you may know if people are using it for goats. But I would only use it if you're having problems. It's not one that you need to be giving animals if you're not seeing this in your flock. All right, I have just a couple more here. Sorry about skipping around on slides. Just two more left. The last disease I wanted to talk to you about was blue tongue, and then I've got just a slide or two on an invasive tick that we've been seeing in Missouri and Arkansas. But blue tongue is one that, is caused by a virus, and you may have issues with it in your area. We've certainly seen it in some flocks. I think mostly south of here, where I'm at in Northwest Arkansas, there's been some outbreaks. But it's transmitted by a fly called culicoides, and that's also known as a biting midge. They're also known as no-see-ums because they're really small. They're like gnat size. They're smaller than a mosquito, so they're very small insect vectors, but they can take a blood meal from a small ruminant and transmit this disease. This disease can also be present in cattle. They don't get sick with it like we see with sheep and goats, but they can carry it. And then deer can get it and other ruminants. But with sheep and goats that become infected, we'll oftentimes see both lameness issues, and then we'll see the oral issues going on. So they'll get oral lesions, and we'll see hypersalivation, a lot of drooling, but they'll also have lameness going on. So you might see them, we see it most often when these flies are going to be present, in late summer, early fall, that time of year. And so oftentimes the guys affected are sort of laid up in the shade, and they're not out grazing with everybody else. And you take a closer look, and then they may be drooling and having issues with a swollen tongue. And sometimes their tongue's even protruding, and that can cause some problems. Once the tongue starts to swell, it can obstruct the airway, and animals can die with this disease. Pregnant animals can also abort from having issues with blue tongue, so it can create abortion and usually early pregnancies because of the time of the year the culicoides fly is out and it's circulating, so it would be in the fall. But other things that we'll see in terms of the lameness that I mentioned is you get what we call hyperemia, which is sort of reddening here where the hoof and the hairline meets right at the top of the hoof. And the animals just get really sore. And sometimes we'll see hoofs that slough. So they get sore-footed and they don't want to move, and they spend a lot of time recumbent and just lying around. Usually we make a diagnosis from the clinical signs that I've described. And with this disease, because it's a viral disease, we don't really have any sort of treatment other than it just trying to support the animals best as possible, make sure they stay hydrated and fed when they're not able to get up and get around and graze like they should. So just supportive care. There is a vaccine available. This vaccine, it's been hard to get and kind of hit and miss in terms of its availability. But one thing I would like to point out is that it has one strain of the blue tongue virus in the vaccine, and we have multiple strains in the United States. So it may not contain the strain that's causing the problem on your farm. It will help reduce sort of the clinical signs of illness that you would see, but it may not completely protect against that because of strain differences and such. But if you're having problems, this will help cut down on the severity of clinical signs. Then the other thing we can think about is controlling the vectors, right? Just the flies that are spreading it. This last couple of slides here is also about an external parasite that affects sheep and goats and other domestic and wild animals. But it's called the Asian longhorn tick. And you may have heard about this tick. It's relatively new to the United States. It just came to the shores on the eastern seaboard in 2017. They first found it, I believe, in New Jersey was the first state. But it's steadily marched west, and we have found it in counties in both Arkansas and Missouri. This tick is able to really increase its numbers exponentially because the female doesn't actually have to breed to lay fertile eggs. And so she can really expand the population numbers very quickly. And you'll get really large numbers of these ticks, and they can actually exsanguinate an animal, which just means to suck the blood from it and cause it to die because of the tick infestation that they have. And I'll show you a slide here next that points that out where it's happened before in Ohio. But you can see that back east in some of the states east of us, there's been higher numbers of these ticks found. I know that they found it right here where I'm located in Washington County in northwest Arkansas and north of us in Benton County, but it's also been found in other counties in the Ozarks. And so it's here. It'll just maybe take time for its numbers to increase, but deer carry it. It's also been found to parasitize birds. And so, it can be spread through the environment quite easily by other animals. But it certainly likes to feed on small ruminants and cattle and other domestic species that we might have on our farm. So it's one just to be thinking about, and be aware of. And it too can feed on people, but it really doesn't like people. It's not one of its favorite meals to get. So we'll see it more often in our ruminants and just to be aware of. But can be in very large numbers. This was a headline I saw in Beef Magazine just last November. So this has only been a couple months ago, but it says Ohio State University finds Asian longhorn tick to blame for cattle deaths. So it had gotten so bad in this pasture of cattle that it had just caused such severe blood loss that the cows died, which could have easily been sheep or goats if they had been located there in those pastures with the cattle. But it points out that the Ohio State professors that were looking at that, it says they collected almost 10,000 ticks within 90 minutes on the farm, leading Dr. Pesapane there to speculate that there was more than 1 million of them in roughly a 25-acre pasture. So they, like I said, their numbers can increase just so quickly because of what they are. But I just want to make you aware of it. It's out there. It doesn't seem like it's near as large a population here yet, but that may only be a matter of time. And I just want to bring that to your attention. And that's basically all I have for you today. I'd be happy to answer any questions, Dr. Brown, if we have some of those at this time.
Thank you so much, Dr. Jeremy. I think we're so privileged to have you today, even though, a lot of glitches and stuff, but thank you for that great presentation. We have some questions, and because we have 10 minutes more, I would love if you can please group those questions together. I don't know if you can see those in the Q&A icon. I just send them over to you.
Okay.
Can you see them?
Yes, sir. Mm-hmm.
Yeah, so if you could please, there are questions on parasite control you mentioned and other few things you talked about. So if you can please group them so we can accommodate a lot of questions, within the 10-minute space we have. Thank you, Doctor.
Yes, you're welcome. And I'll just try and read through these and answer as we go here. It said the first one here was, what are some diseases or deficiencies that could cause hair loss with nose and white spots on hair, with hair loss on the muzzle on otherwise healthy goats? One thing that I mentioned there was ringworm. If it's not that, gosh, there could be other causes of hair loss. I would think, besides that, you may have some mineral deficiencies. Some areas of the Ozarks are somewhat deficient in copper, that we may see that, or certainly we talked about selenium. So providing free choice mineral would be important, and those may be helpful to you if it's not an infectious cause like ringworm. The next one says, is it advisable to give Bosi to the flock as a precaution at the same time as CD&T? Yeah, that's typically what we do with our ewes. As I mentioned in our flock here, during late gestation, we give the Bosi and clostridial shots about a month or so before they're ready to lamb. And then we oftentimes give them both at the same time to the lambs. And usually that, it varies a little bit for us because it's usually a student event, right? Because we're trying to coordinate with a class so students can get some hands-on experience doing that sort of thing. So it's not always at the same time that it might be for producers, but we tend to do it around weaning. And usually our lambs are weaned at around 70 days. And that may vary a little bit, with your flock too, depending on what your situation is. The next was, what was the parts per mineral and loose mineral for selenium? And I mentioned that, you could purchase mineral to feed. I usually look for 25 to 27 parts per million, somewhere in that range for the level of selenium. That's what I would recommend trying to find. And most, well, it kind of depends on the mineral you're purchasing, but a lot of them have that level. And usually, if you're at that level, that should be adequate amounts for them if they're eating the mineral that you're giving. Here's another one. It says, what are some possible causes of abortion otherwise healthy, mature dairy does 6 weeks prior to kidding? Yeah, and that could have been any of the ones I covered for you there in terms of the infectious causes like Campylobacter, Chlamydophila, or toxoplasmosis. And in otherwise healthy, I would point out, usually with toxoplasmosis, the female's not even sick. So they abort, and you see a normally formed fetus and all, and you don't really have a sick female, right? But they had the abortion due to the disease. With the Campylobacter and the chlamydia or Chlamydophila, you do see a sick female. So those would be a couple of things to think about, or even deficiencies like selenium deficiency can lead to things like, or like we talked about with the blue tongue, Cache Valley is another one that I didn't mention or talk about today, but it can create problems for small ruminants. And it gets spread by vectors, so that could be another one. It says a sore mouth in small ruminants the same as cowpox in cattle. They're both pox viruses, so it's not the exact same virus, but they are both pox viruses. So the life cycle or and the size of the virus and that sort of thing would be similar, but they're not the exact same virus. Those are species specific. It says, does worming goats when parasites are dormant kill those dormant worms in the goat? Yeah, that's a good question. And usually on dormancy, in terms of what types of worms go, quote, dormant, we get a type of worm called Ostratagia that can have a hypobiotic state inside an animal, which means that it just goes through a period of time where it's not growing, it's not going ahead and becoming an adult stage where it would begin to lay eggs and such. So if they are in that hypobiotic state, they're usually embedded into the lining of the intestine and the abomasum there. And there are some types of parasiticides that are better at getting those hypobiotic larvae compared to others. And usually those are going to be the macrocyclic lactones. So those are the avermectins and the moxidectin, right? So things like Cydectin, Dectomax, ivermectin. They do well at killing the hypobiotic larva. Haemonchus, however, the contortus that I talked about, Haemonchus contortus, the barber pole worm, they don't really have the hypobiosis like Ostratagia does. And so that would be the one I would be most concerned about. And I would just caution you, you probably need to make deworming choices just based on that one, and not so much worry about the Ostratagia, even though goats can get it, cattle can get it, and others, because of the resistance issues that we see with contortus, and that causing just real problems with snowball effects when you just deworm for one parasite, and then it affects the population of contortus that you're dealing with. So that's what I would recommend. Just deworm based upon what your barber pole worm population is, and use products that would be effective at getting those. It says, what is the best way to treat my goats for lice? And so if you're treating for an external parasite like that, I probably would use any type of spot on or pour on that would be labeled. We don't have any for sheep and goats, so something that's labeled for cattle. One other thing that will kill lice in goats is things like I just mentioned, the avermectins or the macrocyclic lactones. So things like Ivomec or Dectomax, they'll kill lice, but then here again, you're affecting your population of internals also, and so I probably would steer away from doing that and just choose to use something that would be topically applied, that would be approved for cattle. So something like Silence is one, or Cleanup is another one that they sell for cattle. Those kinds of products would be fine. You can get them at your feed store or from your veterinarian. The next one says, how long does CL stay in the soil? 6 months, question mark. No, it's going to be longer than 6 months. I think the last paper I read on that was speculating at somewhere around 18 months was the longest that they had grown it, again, from it being in the soil. So it could be longer than that, right? That's just as long as they went out and tried to detect it. So it's for a very long period. It can last a long time in the soil. The last one here was any general tick prevention tips. Yeah, so we mentioned a little bit about that new invasive tick that we have. So when we found it to be most active, because we've tested our cows here and other animals on our farms in Fayetteville, Arkansas, it was at highest prevalence in May. And usually it was, in pastures that had shaded areas near tree lines, and where there may be also wildlife in that area. So if you were trying to prevent it without using some sort of chemical on the animal, you could do that too. I mean, you could treat the animals with some sort of insecticide, or put, fly insecticide tags in their ear or something like that, which would be helpful at deterring the ticks from feeding. But just note the time of year that's going to be most prevalent is probably spring. And if you can graze pastures that are not near wooded areas where there would be other wildlife, that would be ideal to minimize the risk. And also, like, if you can clip pastures where you don't have extremely tall forage in that pasture, that may deter ticks from being there. So those would be some things to consider. Those are the ones that I see there, Dr. Brown. Anything else that I can try and help answer?
Oh yeah, the last one, Dr. Jeremy, does foraging I'm not sure how to pronounce this now.
Chicory.
Say it again, please.
Chicory.
Chicory help with worms. I don't know if it contains tannin. You want to answer that, Jeremy?
Yeah, so that's a good point. Yeah, so there has been some work done. I know with tannins, I think some of that had been done by Dr. Joan Burke, where they were grazing different types of grasses that contain tannins. And I think, I don't know if chicory was one that they tried to dose animals with, but they used Lespedeza, I believe, and maybe bird's foot trefoil was another forage that they were grazing. But it seemed to have some effect, right? It wasn't like we would expect to see a decline in the population when you used a dewormer that was effective. It didn't cause that just massive drop, but it seemed to help. So it may be something that you consider along with rotational grazing and things like doing intermittent fecal egg counts and FOMACHA scoring, but it may be another tool that you might be able to use to help reduce the amount of parasites that were on a given farm. Also, I've seen data on copper oxide boluses, and people get real concerned with copper in sheep, but it may be something that you get to use for goats. But it seemed like the copper oxide boluses improved the effectiveness of some dewormers, and then also help just by themselves minimize the parasite infection. And you may just Google copper oxide bolus for parasite control. That may be another option for you. The copper oxide boluses have been used in sheep too, and copper oxide's not quite as bioavailable as some other forms of copper. So, copper sulfate oftentimes is what we see in a bag of mineral. You give too much of that to a sheep and you're going to cause toxicity. But copper oxide's a little less bioavailable. So it's not like they're going to perhaps have overabsorption and the toxic effects with that one. But I've not used it myself, so I really can't speak firsthand. And, it might be something you discuss with your veterinarian or look for recommendations to do that.
All right, thank you so much, Doctor. I think you really covered a lot. We're going to get the presentations across to all the participants. We really enjoy your talk, and you share a lot of information. We have a lot of chat going on, and I'm going to forward more questions, from the people to you. If you don't mind, please answer them. Once again, thank you for coming, and definitely for sure, I'm still going to ask you to please come again before the year runs out, so we can have another comprehensive time with you. Thank you so much for joining us today. It's been a very amazing time, and we apologize again for the glitch we had, but we're able to at least, knock this out. Thank you, Jeremy, and have a great day, everyone. Thank you so much. Bye.